Okay, welcome everybody, and thank you for being here today. My name is George Barrow, and I'm joined by my colleague, John Diamond. John is the Kelly Fellow in Public Finance and the Director of the Center for Public Finance here at the Baker Institute. So today, John will be discussing the economic effects of the COVID-19 pandemic and the corresponding legislation to mitigate the economic impact of it. So before we get started, I'd just like to let you know that if you'd like to submit a question, you can do so in our app, in our Zoom chat and Q&A features, and we'll get back to it at the end of John's presentation. So we hope to hear from you, and on that note, I'll turn it over to John.
Thank you, George. So I'm going to share my slides as the host has disabled my slides, supposedly. There we go. And so with that, we should be able to get started. All right, so I'm going to discuss today the effects of the COVID-19 and the fiscal policies to the health crisis that we're facing. I'll start out with just a look at what we've been seeing around the world in terms of the virus infection rates and fatality rates. We can see the U.S. by far has the most cases. Fortunately, our death rate per million people is relatively low. We can see death rates or case fatality rates in the middle column, all of which is pretty historical and sad at the same time. These are the times we live in, and the question is, how are we dealing with them? I also have some data specific to the Houston area, since we're located in Houston. You can see that the Harris County metropolitan area has about 5,500 cases. If you look at the bottom graphs, it looks like we're getting close to plateauing, with the red line kind of starting to plateau, and the orange line, which represents daily new cases, those are going down just a little. At least since 4/9 through 4/14, we've been seeing a reduction. And that brings us to the economic front, which is very rosy of late. The biggest thing we've seen in the last 3 weeks are initial unemployment claims just skyrocket, unprecedented levels. And these graphs by the Department of Labor show that the last year of initial unemployment claims, and if you plot over a very long time period, say the years, it would look very similar to this, just a longer flat line at the beginning. And then we reached these last few weeks where in the last 3 weeks, we've seen 3.3 million, followed by 6 million, followed by 6.6 million initial for unemployment insurance. Bottom graph, we see the seasonally adjusted insured unemployment rate, and we can see that that's going up rapidly from somewhere just under 2 million to now we're just over 7 as of last week, or actually that was as of March 28th. Unfortunately, I think we're going to see these numbers continue to increase and increase rapidly over the next few weeks as more people are unemployed or furloughed, file claims for insurance and start to take advantage of that insurance. And that leads us to the economic projections, which are just flat out dismal. So CBO on April 2nd projects that for the second quarter of 2020, the unemployment rate will increase to 12%, and that GDP will decrease by more than 7% from Q1 to Q2, which is the same as saying that the GDP growth rate would decline by 28%. Unfortunately, they note in this April 2nd document that much larger declines are possible, and I think probably expected. If we look at private forecasters, JP Morgan's latest forecast on April the 10th shows employment rate reaching possibly 20%, and a potential contraction in GDP of 38%, which is, again, just unheard of type of economic numbers. We predict a rather quick recovery in quarters 3 and 4, which is the good news, a sea of bad news. Finally, on this slide, we can see a projection by the Committee for a Responsible Federal Budget. They forecast budget deficits using much of the data that CBO provides. They forecast deficits for this year, 2020, of $3.8 trillion, or 18.7% of GDP, and that the debt held by the public will be greater than GDP by the end of 2020. Both are very large numbers, problematic numbers, but numbers that for the time being we have to accept as we deal with the crisis from the coronavirus. Moving along, we can look at data for Texas. Claims since mid-March were 145,000, or 5.3% of the labor force. The weeks unemployment claims came in at 313,000. The percent of workers in high-risk industries, so this is the percent of workers in industries that are not labeled essential and are likely to be affected by the shutdown. That number is 19.6%. And the projected unemployment rate in July of 2020 is around 15.2%. That's a disturbing number. Other data that have kind of pulled out is looking at how many households have paid their rent on time in the Houston area. And the most recent estimates show that it's decreased from 88% a year ago, last April, to 79.4% this April. So there's been an 8.6 percentage point increase in the number of households that are late on, meaning they didn't pay rent in the first 5 days. And it's worth noting that this is the highest among all of Texas's largest cities. We can also think of small business health in Houston, and there's a lot, and we'll talk a little bit about small businesses when we talk about some of the congressional acts that have been passed. But the Greater Houston Partnership put out this study from their first Houston Business Barometer survey that was taken April 3rd through the 6th. This is data from 90 small businesses. 84% of the small businesses have instituted work from home policies. 22.5% have either shut down the whole operation, or at least implemented a partial shutdown of their operations. 36% of them have enacted a hiring freeze. 53.3% said that operations were severely impacted by the crisis, whereas 28.9% state that their operations have just been moderately impacted by the crisis. An interesting question is, how long could small businesses stay open if the federal government did not provide them assistance and we continue under these stay work safe policies that we currently live under? In that case, we see that between 3 and 4 weeks and 5 and 6 weeks, 0.7% of the firms predict they would have to shut down. So that's a total of about 13.4% of the firms in the next 6 weeks. If we stretch that out to eight weeks or 2 months, 2 months from now, if there was no federal assistance and we continued under these orders, it's likely that we could see 25% of our small businesses shutting down. That's a gigantic number, and one that we want to avoid. And that brings us to the question: given these economic projections, what should the government be doing at this time? And fortunately, the government has already stepped in and done a lot. The first bill they passed was a Virus Preparedness and Response Supplemental Appropriations Act. It authorized $8.3 billion in emergency funding, $3.1 that went to the Department of Health and Human Services, $950 million for state and local health departments, $300 million for vaccine development and treatments, and $1.25 billion for international aid to low and middle income countries. They followed that bill with a bill, the Families First Coronavirus Response Act, which provided free coronavirus testing to the public. It also provided paid sick and family leave programs. Note that this was only for firms less than 500 employees, that had less than 500 employees or more than 50 employees. Those benefits equal $511 per day for 2 weeks under the paid sick leave provisions, and $200 per day for 12 weeks under the family leave program. The JCT estimated that these provisions cost about $105 billion in total. It's worth noting that a lot of people, approximately 48% of the workforce, is not covered under these two provisions. And so I would state that a problem with current legislation is that these two provisions are probably too narrow, in the extent that if you look at, say, grocery stores, they're going to have 500 employees, but their workers would not be getting the federal help from these paid sick and family leave programs because their firms are sized out. This bill also allocated $1 billion in grants to states for expanded unemployment insurance and dedicated more than $1.5 billion for food assistance programs. By far, just action taken was the Coronavirus Aid, Relief, and Economic Security Act, otherwise known as the CARES Act, which was roughly $2.2 trillion in aid that is going to be passed out to individuals and businesses. So the business provisions included $500 billion for larger companies, with $50 billion of that going to the airlines. I should note that this $500 billion, or the $450 billion that was left, was given or was in a Fed facility and will be loaned out to the Fed, which essentially makes it or increases the amount from $450 billion to about $4 trillion worth of loans that the Fed can give out to larger businesses. The bill also included $350 billion for small businesses and $150 billion for hospitals and healthcare providers. Provisions targeted to individuals included direct payments of $1,200 per adult and $500 per child. This was phased out at a 5% rate above $75,000 for single households and $150,000 for married households, and had a cost of $292 billion. The individual provisions also included a 13-week extension of unemployment benefits, including an additional $600 per week, in addition to the state benefits that are normally paid. This bill also included a provision for funding short-time compensation programs. So these are programs instead of laying off a worker, a firm can just reduce the hours worked, and then the employees can receive prorated benefits from the federal funding programs. If the state currently had a program, the federal government is funding 100% of these benefits, and if they create a program, the federal government will fund 50% of this benefit. In addition, the act had allowed for an above-the-line deduction of charitable contributions. So even if you don't itemize, you'll be able to deduct your charitable contributions this year. And it made several changes to retirement plan rules in regards to are you penalized if you withdraw money, and to the firm's ability to deduct paying off students' loans. in evaluating these rules, it's our view. So George wrote a policy brief on this, and we thought it was important that these policies adhere to several guidelines. And so we'll look at that. I'd like to note that so far it's pretty clear that all of the policies were largely necessary. More fiscal measures are likely to be required soon, and I think the first on the list is we're going to need additional small business relief, and that needs to happen ASAP. I've seen reports that at the end of this week, the government will have exhausted the first $350 billion in relief for small businesses. So we do need additional funding if we're going to continue to help out small businesses. And the data I showed earlier about how the crisis has impacted small businesses shows how important that is. But all of the actions that are being taken need to take into account that these actions will have a long-term consequences for the U.S. economy. And so to balance the line between taking action that helps us now and also taking actions that leads to as little damage as possible in the long run, I argue that the action should first and foremost be temporary. So we don't need, this is not the time to pass permanent policy changes. If there are long-term policies that are worthy to be passed, we can do that when we're out of this crisis. This isn't the time to play political games. We need to be passing policies as quickly and efficiently as possible. It's also necessary that the policies be targeted. So we should try as hard as we can to give money out to the most in need and to avoid giving money out to people that currently are not in need. Obviously, that's a pretty basic reasoning there. In addition, I didn't put it on the slide, but transparency is important, especially in regards to the business loans. I haven't seen how we're going to state who received money and how much, but in the long term, I think it's necessary to know where the money went and who it went to and how successful it was at achieving its goal. Lastly, all of the money should be used for one of three purposes. Mainly, we should either be maintaining business knowledge, existing business knowledge, or existing supply chain businesses. So the goal of health businesses and large businesses is to maintain the structure of the economy so that once we're on the back of the health crisis, firms can start rolling again, and they'll know who to buy from and who to hire. And existing firms already have their supply chains. They know who they're going to buy it. They know where they're going to hire their workers from. They have a good idea of who they sell to and the price points that they can sell at. And maintaining that kind of knowledge will just speed up the recovery once we're out of this crisis. So we need to focus our business health in that area, just maintaining current businesses and their ability to operate in a normal environment, not in this catastrophic environment. Also, we need to maintain sustainable consumer finances. So we can't have consumers or households that are forced to stay home that have no income and yet not give them any assistance. So really, we need to continue to focus our fiscal help in those directions. We should avoid policies such as proposals to institute a minimum wage or environmental policy changes or same-day voter registration or retroactively repealing the state and local tax deduction cap. While any one of those may be a good policy, this just is not the time to pass permanent policy changes because that would only slow down the needed change, the needed policies that need to be passed relatively quickly and don't have the time to go through the normal policy debating system. So that's what we've done. We're going to need more policies like the ones that have already been passed, depending on the duration of the health crisis. And at this point, I think there's some bright spots we're starting to see in terms of the curves starting to bend downward. But it's too early to claim victory yet. However, we do need to start thinking about when is the right time to start the economy, and what do we do as we move into recovery and eventually out of recovery. And that's something, that's a process that's probably going to be going on for quite a while. These are tough decisions. So if we restart early, we risk having the virus spread widely again, having to undertake more stay home, work safe policies. If we wait too long, that would increase the economic cost and also several health-related costs. And overall, ultimately, it's going to affect the shape of the recovery. So if we wait too long or we don't spend enough money to maintain firm infrastructure and supply chains, then we're going to see a case, a recovery we may not want to see. So examples, you keep hearing the alphabet of recovery. So people are hoping that we have a V-shaped recovery. But other possibilities would include a U-shaped recovery, which is a period of recession followed by a recovery, or a W-shaped recovery if we come out too soon, in which we recover and then just there's a large spread of the virus and we have to lock down the economy again. And if we just to maintain supply chains and we allow too many firms to collapse, then we could end up in an L-shape where we have a very long recession at the end of the current crisis. Most importantly, coming out of this, I think we need to increase our testing. We need population-wide testing so that we can combat this virus using knowledge of who are the carriers of the virus, instead of who are the sick carriers of the virus. If we could get to the point where we knew the asymptomatic people, then we could slow the spread substantially. Two other important points. People talk about returning to normal. I don't know what normal will look like at the end of this. I think we will return to a new normal, and we will probably have adopted many new changes that we learned about in the crisis. And then there's going to have to be a major fiscal turning point. So the economy was, we had a great economy for the last 10 years, but even before the current health crisis hit, it was predicted that the deficit this year would be $1 trillion. At some point, we're going to have to pass sustainable fiscal policies. And after this crisis, in which we've already spent about $3 trillion, and we're projected to have deficits of $3.8 trillion this year and almost $2 trillion next year, adopting a sustainable fiscal policy is critical as we move out of the crisis and into another recovery and economic expansion. So with that, I'm going to stop and we'll take your questions. I thank you for joining us today and hope that you've learned something or enjoyed the talk.
All right, thank you, John. That was a great presentation and obviously covered a lot of ground there. So if I might, I'd like to ask you a question that's kind of been on my mind, and then we'll get to some of our viewers' questions. But we know that a lot of the households have been hit hard. We know that a lot of businesses have been hit hard. And we know that the federal government, we might expect, is going to have a sharp decline in government revenue. But we know that the government, at least at the federal level, can use debt to make ends meet throughout this pandemic. States and municipal governments, on the other hand, do not have the resources that the federal government has. So, to what extent do you think the federal government might be able to come in and, maybe not bail out the state and local governments, but use their resources to help state and governments meet the needs of the people in their areas?
I definitely think there's a role for the federal government to come in and um, help out state governments. Obviously, states are probably not going to be able to afford a lot of the cost that are being imposed upon them at this time. I would caution, though, that states had a lot of unfunded pension debt going into this crisis. And I don't think this should be an excuse for the federal government to bail them out of that problem. In other ways, but I think to the extent states had fiscal problems before the crisis began, just like the federal government had a fiscal problem before the crisis began, this isn't the time to bail out those governments.
All right, thank you. So we have a few questions from our viewers. One in particular refers to this public infrastructure bill that's been under consideration now for several years. With the decline in the federal tax revenue, where do you think that issues like public infrastructure spending might fall, in terms of priorities as soon as we make an attempt to reopen the economy?
Or improved public infrastructure. And honestly, if you're going to debt finance anything, debt financing public infrastructure seems to make sense since it's a long-term good, as opposed to debt financing current consumption. I think we need to be very picky in what we fund. Obviously, we've overconsumed up to this point, even include all the money we're spending on the crisis, and we just look at the 17 trillion in debt we had before that. We're going to have to deal with that problem sooner or later, but I don't think you deal with that by allowing your infrastructure to depreciate and be dilapidated. So I'm for public infrastructure. It should be high on the priority list, and financing that I think is a reasonable thing to do.
All right, thank you. So the next question refers to our response to the COVID-19 mitigation efforts relative to the efforts that other countries have taken. So some of the other countries have done things like maintained workers' wages throughout this time period. But we haven't done quite the same thing. We've relied maybe a little bit more on unemployment insurance that, at least for some people, doesn't give them as much as they were making before they were separated from their job. So can you evaluate our response relative to the other countries that may have offered maybe the employees an opportunity to maintain their wages throughout this crisis?
I think in general, I would be in favor of maintaining wages throughout the crisis as opposed to the unemployment route that we've taken. And I think we also should have done this through small business and medium-sized businesses, so that not only did we allow them to maintain their work, so helped them with fixed costs such as rent and utilities. And what I like about that approach is it could be temporary, it could be targeted. When the crisis had passed, we could pull back. One of my concerns with unemployment is if we keep extending it, we could end up in a situation like in the 2008 financial crisis, where we extended unemployment benefits for up to 99 weeks. And research has shown that a lot of people waited until the last 2 weeks of their unemployment. They waited until Their unemployment benefits were about to run out before they started looking for a job. Obviously, moral hazard is not an issue right now when people aren't allowed to go out and look for work. But 6 months from now, a year from now, it's possible that we could start seeing some of those impacts if we're still offering generous benefits and the economy has reopened and people are able to go out and get jobs.
All right, thank you. I see a few questions regarding the unique situation that we're facing here in Texas. So we got hit especially hard because of not only the COVID-19 crisis, but also the plummeting oil prices. So to what extent do you think that Texas might be hit harder than other states, and to what extent do you think that we might recover at a different pace than other states?
I do think there's the potential for Texas to be hit harder. In fact, I mean, we even without this crisis, the oil price decline probably would have had a severe impact on the Houston economy, with oil prices being down to $20. Now, they wouldn't have been that low without the decrease in demand as well. But that would have been a pretty large negative impact. So I think we're going to get hurt worse. Houston is a large trade city with the fourth largest port, I think, in the U.S. And with trade being slowed down, that's going to cause jobs. It's going to create unemployment just from a decrease in trade. So I think there's a lot of factors that imply that Houston may get the worst of this in terms of the economic side of it, whereas we're doing okay on the health side of
it. Okay, thank you. So there's been this big concern about the PPP and the transparency and the possibility that it could be influenced by politics. To what extent do you think that transparency would help make sure that the funds get to the companies that need it the most, and not necessarily, companies that would be potentially offering a political favor?
Yeah, I think that's critical. That at some point we know who gets the money and how much they got and what they did with it. Now, I am sympathetic to the idea that even in these times, companies don't want to send a signal that they're in trouble. And so they don't want people to know immediately that they've had to take a bailout, so to speak. And so I do think that it would be a bad idea to wait to publish that data for a few months, but eventually we should be able to account for every dollar that was given out as either a loan or as we're doing with small businesses, these quasi grants, if you pay wages and fixed cost with the money.
Okay, so the next question refers to the response by the Federal Reserve. So over the last several years, we've had interest rates that are extremely low. Inflation has been low, but right now we have the Federal Reserve doing something that we may not have seen, at least for several decades. But interest rates close to zero, extensive monetary policy, monetary stimulus. Is there a concern that inflation might start to creep up, and maybe with such an intense response by the Federal Reserve that inflation could even build up more than expected and perhaps get away from us?
I don't see a real concern for that. I think, in fact, the big concern immediately is that we could have deflation, which in some respects is harder to deal with. There is research out there on what happens during pandemics and the economic consequences of pandemics. And so what we saw with several pandemics stretching back to the 1300s, is you would wipe out a significant percentage of the workforce. So you're changing your ratio of labor to capital. And that would actually lead to an increase in wages. But since you had more capital than labor, it would lead to a decrease in investment and a decrease in interest rates after the pandemic resolved. Now, this pandemic is slightly different because we're not losing young employed workers. Unfortunately, it's hitting the elderly and many retired. So I don't see the wage impact occurring from the coronavirus pandemic. But I do think you will see, with increased savings and a decreased demand for investment, that you're going to see long-term interest rates continue to go down. And there's going to be this long-term downward push on asset prices. So I'm not very concerned at this moment about inflation. That's something we should keep an eye on maybe a year or two from now. But currently, keeping asset prices up is our real goal.
Okay, thank you. So on the household side, you talked a little bit about moral hazard, some of the issues that can happen if we extend unemployment insurance for too long. It can discourage people from looking for jobs and maybe extend the duration of this impending recession. So we know that on the household side, there can be a number of different ways that moral hazard can influence outcomes and delay the recovery. But are there any moral hazard effects that we should be careful of on the corporate side? Are there ways that corporations can maybe misuse the money or use them for reasons other than they were intended?
So let me just state that I don't think moral hazard is a current issue. Again, that's a long-term issue I would be mindful of. So well into the recovery, maybe a year from now, if we've gotten rid of the virus and we don't have any of these lockdown effects, then we can start thinking about moral hazard. But currently, when people are forced out of work, there are no moral hazard issues, even on the individual side. At least not large ones. On the core, I think there are moral hazard issues, just like there were in the 2008 financial crisis, but not exactly like that. In the financial crisis, we had seen behavior, firms had made decisions that led to the crisis. No firms made any decisions that caused this to happen. So I think there's a real distinction between the 2008 financial crisis and in terms of corporate behavior. My bigger concern is that if we don't take the necessary steps to maintain infrastructure of small and medium-sized businesses, we'll end up with large businesses coming in and buying them out, taking them over, and just growing larger. And I have a real concern that we could end up with less competition, larger businesses that have more market power. And when you have larger businesses with more market power, they quit competing in terms of producing the best product at the lowest price, and they start competing in terms of rent seeking by having the government protect their profits. And I think that could be a huge negative if we don't take the necessary steps to support small and medium-sized businesses now.
All right, thank you. And I think we have at least time for one more question. So there's been this disparity in the extent to which this COVID-19 has impacted different demographic groups, for example, by race or ethnicity. What steps do you think that the federal government can take in addressing these issues when they reopen the economy? Are there certain sectors of the economy that maybe we want to delay, or are there different things that the federal government might do in terms of providing PPE or different resources to certain demographic groups to mitigate the impact of the rates of infection that might be heightened among these groups?
I don't really have a great answer for that. You know, we see people that are in poverty being impacted more, and I think that's because they live in households that generally have more people in the household, and they work at jobs that may expose them more to the virus, in the sense that they're not capable to work from home, and if you're stocking groceries or working at a grocery store, or you work at a restaurant or a food establishment. I don't know how we deal with it. I don't have a good answer for that question. It's an important question. It's one that we should think about. But unfortunately, it does seem like a pretty hard issue to deal with. I do think in terms of, you know, we could think about how to reach certain safety nets in order to maybe benefit people more, and to create incentives that would allow for the economy to be more efficient. But I don't think that would directly necessarily impact the you know, the distributional effects of even this health crisis.
All right, thank you, John. I think that's pretty much all the time that we have for today. So thanks again for your presentation. We really covered a lot of ground in a short amount of time. I'd also like to thank our Baker Institute staff that did a great job helping us prepare for this webinar, and helping us, you know, maintain our policy outreach and preparing this webinar. And most importantly, thanks to everybody who chimed in. We read a lot of your questions, tried to get to as many as we could, but I just want to let you know, if you have any other questions, please don't hesitate to reach out to us, to John or me. We'd be happy to try to get back to you as soon as possible. So that concludes our seminar. Again, please feel free to reach out to us. We hope you enjoyed it, and we hope to hear from you soon. So thanks again, and we'll be in touch.
Thank you, George. Thank you to the staff, and thanks for everybody that listened. And we'll try to post the slides online.
Thank you.
Bye-bye.